All right, this is the lecture for module number 6 for Medical Ethics Online. I'm again Eli Weber, your instructor, and the focus of this module is issues of justice related to access to healthcare. And we're going to formulate these issues in terms of one specific question, which is whether or not there is a right to healthcare. I apologize for the background street noise. I'm recording this lecture in Manchester, England, where I'm at a conference, and the street noise outside is quite loud, so I apologize if that's being picked up on the recording. In any event, we want to talk about whether or not there is a right to healthcare, because whether there is a right to healthcare bears a great deal on what sorts of services we're obligated to provide, what sorts of social obligations might be imposed upon us as part of that project of providing these healthcare services that people actually have in virtue of a right to healthcare. So this is a pretty important question. And as we'll see a little bit in this lecture, and hopefully from some of the discussion and that follows, we're going to see that lots of other questions sort of fall out of asking this very general question. And the goals of this lecture are going to be to first consider what it might mean to claim that there is a right to healthcare. Because when we say, oh, people have a right to healthcare, there are a lot of things that could mean, and so we want to be clear about exactly what the debate is or might be about. Then we're going to examine a couple of arguments in favor of a right to healthcare and note some problems with those arguments as well. And then we're going to think a little bit about some further problems just with the concept of a right to healthcare. What further questions we ought to ask if we think that there is a right to healthcare, what that implies for all of us. And finally, we're going to talk about this concept of a decent minimum of care or a decent minimum of health. This was discussed by both Norman Daniels and Tristram Engelhardt in the reading for this module, and so we want to take a look at the different ways that they understand this concept, because lots of folks think that the answer to the question of what a right to healthcare should consist of can be best answered by appeal to something like a decent minimum. But we want to look at these two different ways of understanding that, just if nothing else to note that that doesn't resolve the debate. We still have to talk about what that actually means. All right, let's start by asking what kind of right a right to healthcare could be. Well, there's a distinction, and actually two distinctions that are sort of discussed in the reading for this module. One is the distinction between a positive and a negative right. Now, to have a negative right to something is just to have a right of non-interference. So what negative rights do is they obligate other people not to interfere with what you're up to. So your right to freedom of speech, for example, is a negative right because it's a right to not be interfered with when you're speaking, even in a public place, about a controversial topic. Now, a positive right is going to impose more specific and more demanding obligations on other people. Negative rights are thought to be more readily defensible simply because they don't impose, there's not much that people have to do in virtue of your negative right to something like freedom of speech. It doesn't require that I sort of provide you with a venue for expressing your views. It doesn't require that I sort of support you emotionally or applaud you when you're done, or even engage with you in public discourse when you're exercising your right to free speech. But a positive right is different. A positive right says that you have a right to something, and in virtue of that, other people are obligated to do certain things. Positive rights are also understood as what's called welfare rights. These are rights that require other people to give things up beyond just sort of being able to mess with you in order for you to benefit, in order for your right to be respected and their obligation to be satisfied. So positive rights are more demanding on us than negative rights are. And it's actually pretty difficult to come up with a positive right. Some people defend social assistance programs in virtue of positive rights, but it's not clear exactly what the positive right is. A right to sort of a basic minimum standard of living or something like that might be one possibility. But it's not, in general, their positive rights are much more controversial in virtue of the greater obligations that they impose. And another distinction we should draw, and what we're doing here is just sort of carving out the territory of different kinds of rights so that we can understand what kind of right a right to healthcare would be. And another distinction that we should note is the concept of a legal right versus a moral right. Now, a legal right is something that's bestowed upon you by the state. You have this just in virtue of some government body saying that you have it. Now, the government body has to have the authority to grant you rights and to sort of enforce the rights that you have. This is why things like the United Nations Declaration of Human Rights is not very sort of effective in ensuring that these rights are guaranteed, because the United Nations doesn't have any actual authority over the global community. So this is one of the sort of criticisms of things like the UN Declaration of Rights, is that this is a body that has no authority to give rights to anyone. Lots of rights. Your right to vote, for example, is a legal right. It's a right that's bestowed upon you by the state. And then a moral right has a slightly different source. A moral right is a right that either is or is typically thought to be a consequence of things about the rights bearer. So we hear rights language when people talk about a right to life, both in the abortion debate and in other contexts. In the euthanasia discussion, we'll talk about a right to life as well. The right to life is going to be a moral right, whereas discussed as a moral right, not just a legal right. Because in the abortion debate, for example, does a fetus have a legal right to life? Well, no, because abortion is not presently illegal. So the debate is about whether or not they have a moral right. So in virtue of things about the fetus, does the fetus have a moral right to life? And we're not dealing with that question in this course, but that's an example of a moral right that may or may not be supported by a legal right. At present is not, but could be and has been in the past. Okay, so just to be clear, legal rights come from the state, moral rights come from things about the rights bearer. And then what's typically thought is that moral rights and legal rights are related in sort of interesting ways. We tend to think that in virtue of having moral rights to something, that's a good reason for a state to grant a legal right to it. Okay, it seems, and this is a topic for disagreement, but it seems to me, this is part of the course where I get to interject my views on this topic, that that the right to healthcare is a positive moral right. That's what the discussion is about. Because do people have a legal right to healthcare? Well, it doesn't look like it. And if they do, it's going to be a right only to things like emergency care, right? Because hospitals are legally obligated to provide emergency care. If I walk in the door of a hospital and I'm bleeding to death, the hospital's obligated to provide emergency care for me. But they're not obligated to provide preventative care if I need vaccines or something like that, or if I have the flu. In general, they're not obligated to do that. So, but that's part of the debate as well. It's just not part of the debate that we're going to look at, because it may be, and some people think that we have sort of inadvertently acknowledged a legal right to health care. But I think the more interesting debate, and the debate that seems to be coming out of the readings that we've done for this section, is the question of whether there's a positive moral right to health care. So in virtue of things about us, do we have a right to health care that requires other people to do certain things and give up certain things? A couple reasons to think that this is what the debate's about. First, because a negative right to health care, if this were construed as a negative right, doesn't guarantee access to health care, right? If we have a negative right to health care, and that just means that people are obligated not to interfere with my trying to get health care, that in no way guarantees that I'm going to be able to get health care, because I might still be too poor or too ill-informed or live in a place that's too rural or something like that. There are lots of reasons why I might not be able to get health care, even though no one is interfering with my ability to get health care. Another reason I think we should construe this as a positive moral right, or talk about it in those terms, is that legal rights, as I mentioned, are often, though not always, conceived of as tracking moral rights. So the idea is that we have legal rights to things in virtue of moral rights that we have. So freedom of speech is an example of this. Lots of philosophers have argued that there's something sort of morally good about having freedom of speech. that states have a kind of moral right to, or a moral obligation to respect freedom of speech of for their citizens, and that this should be protected by a legal right along the same lines. Now, it should be noted that the Engelhardt reading, Engelhardt is pretty opposed to this idea of a positive moral right to health care. He says, look, there presently is no legal right to health care, in spite of concerns that we may have inadvertently granted this. And there can't be a positive right, moral right to health care. We shouldn't be arguing for something like this, because a right like that, because it's a positive right, would impose obligations upon other people, and those obligations would violate their property rights. So the thought here is that, on Engelhardt's view, people have a right to keep their own property and do what they want with it. This is kind of the libertarian position. Libertarians tend to think that freedom is the most important value, and this is one of the rights that they're particularly concerned with, is freedom to do what one wishes with one's own property. And Engelhardt says, look, to recognize a positive moral right to health care would then obligate other people to give up their own property, whether they want to or not, and that would be an egregious violation. So he thinks that there's a serious problem with claiming that there's a positive moral right to health care. Now, let's talk a little bit about different arguments for this positive moral right. This comes from the Daniels reading, but it's also discussed in the Engelhardt. One argument is the argument from what's called collective social protection. The thought here is that collective resources are frequently used to protect citizens against common threats, like fire, pollution, and crime. So we often sort of pool our resources in this way, usually in the form of contributing to a pool of money that's then sort of distributed appropriately by governments in order to protect everyone against fire or crime. We have a police department, we have a fire department, we have environmental inspectors and standards and things like that. And this is because a lot of folks think the government is obligated to protect us from these sorts of things. Well, the way this argument goes is that the protection of our health is similar to these common threats. So just like when there's a fire, we want the fire department to come and put it out. When you're sick, you know, we want people to be able to go to the doctor. Protection of health is sort of the same kind of protection. So consistency in our policies requires that collective resources be used to protect the health of citizens. Yeah, so the thought here is just that we already provide social protections of various kinds by sort of pooling resources, and protection of health isn't any different from that kind of stuff. So just for the sake of consistency, we have to protect health as well, and we do that by providing health care, by granting people a right to health care of some kind. Some people disagree with this because they think governments are not obligated to provide these protections, that it's sort of something that they do but that they need not do. They wouldn't be failing an obligation if they didn't do it. And some people think that health is importantly not the same as something like protection from fire, pollution, and crime. But it seems like this argument, even if you find it somewhat compelling, is not going to be as convincing as a couple of others. So let's go ahead and look at a couple of other arguments as well. We should briefly talk about the utilitarian argument. Now, remember, the utilitarian view is roughly the view that whatever, from some set of possible actions or choices or policies, we should assess as far as we can which policy is going to have the greatest positive consequences overall, and that's the thing that we should do. So to the extent that access to healthcare has these sort of what are called positive welfare benefits, to the extent that it makes people better off, we have a reason to provide access to healthcare. However, it's not clear that this is a right to healthcare. It seems like what it is just sort of it's a justification for access to healthcare, but that's not the same as a right. It doesn't necessarily impose specific obligations on people in the way that rights do. It's not something that is sort of protected once it's granted in the way that rights tend to be. And it's not clear further that the utilitarian analysis justifies heavy investment in healthcare rather than other kinds of social enterprises. It might be that on a utilitarian analysis, what we should really invest in is clean drinking water for people, or education, for example. So it's not obvious that if we are utilitarians that we're actually going to end up with a view that says we should invest heavily in healthcare. Because the reality is, for the utilitarian, that we have finite financial resources. So even if we are attracted to the utilitarian analysis, it's far from clear that what we're going to get out of that is sort of a strong right to healthcare. We may get something else entirely. And then finally, there are some objections to the kind of cost-effectiveness analysis that would no doubt take place under a utilitarian system. The worry here is that there are some kinds of life-saving treatment that are sort of massively expensive, where the return on the investment is pretty poor. We might transplant a new liver into someone so that they can live for 6 to 8 years. That's sort of an average survival rate for a liver recipient, for example. And you might think that that's okay, right? That thinking about sort of the dollars involved and sort of the costs, the benefits associated with the payout is just the wrong thing to think about in healthcare. We tend to find that kind of repulsive, right? We're sort of disgusted by the idea of sort of putting a price on health and putting a price on survival. But the utilitarian says, no, that's what you do. So what utilitarian healthcare might look like is heavy investment in preventative care and very little investment in sort of life-saving care. And so the concern here is that lots of people think that a right to healthcare would include at least some of that sort of life-saving care that might be ruled out by the utilitarian view. Okay, so the final argument that we're going to consider before thinking about some concerns and problems with this is the argument from fair opportunity. I'm just going to read this because it's a little more complicated than the others. The first premise of this argument is that institutions are just, so they're fair, in other words, to the extent that they counteract inequalities that are a result of luck, chance, and other factors over which agents have no control. So the idea is that when we're trying to decide whether something like our school system is fair, we need to look at whether or not it serves to counterbalance things that affect how well people are doing that aren't their fault, right? So a fair school system, for example, might be one where people who are born into greater poverty turn out to be just as successful as people from affluent neighborhoods. So unfair educational systems would likely have it be the case that how wealthy your school district is determines or is a good predictor of how wealthy you're going to be in your own life. And so this is a theory about how to assess the justice of institutions. It's the institutions are just to the extent that they serve as a counterbalance to natural inequality, things that people aren't really responsible for. Well, second premise, ill health and disease, these are inequalities that are mostly beyond a person's control, right? So the fact that you were born with some sort of genetic disorder that requires you to have all kinds of health problems and sort of healthcare needs, that's not really your fault, right? That's not something that you're responsible for. So it's in some sense unjust or unfair that this is imposed upon you, the added burdens of this. Well, if that's true, if poor health and disease either is an inequality or sort of contributes to inequality, and the justice of institutions depends on the extent to which we correct those inequalities, then justice, which is a significant moral principle, both within medical ethics and just in general, demands that the inequalities imposed by health be counteracted. So the thought here is that if people have a right to equality of opportunity, we all deserve sort of the same opportunities to achieve our goals and be happy and that sort of thing. And if certain factors that aren't the agent's fault negatively affect those opportunities, what makes an institution just or fair is that it corrects those undeserved inequalities. It sort of corrects for the natural inequality that occurs. This might be a convincing argument, although Engelhardt notes, and it's worth thinking about, that this imposes obligations on other people to compensate for injuries that they're not responsible for. So in other words, if I'm a rich guy, it's not my fault that you have, you know, multiple sclerosis or something like that, or muscular dystrophy, or, you know, some other disease that's just in no way something that people are responsible for. So by saying that people have a right to health care in virtue of a right to fair opportunity, what you're doing is asking me, the rich guy, to compensate for injuries that I didn't cause in you, right? So it's not my fault that you need a bunch of additional health care, right? That's not my fault. So the concern here, this is again this libertarian argument that Engelhardt wants to push. He says, look, these are unfortunate, unfair circumstances, right? But that does not imply that other people can be forced to give up their property to provide compensation for these injuries in order to sort of level the playing field. Now, Engelhardt does think that if people agree to this, right, so if we all vote, or if our representatives vote on a policy like this, that would be acceptable. But then it's because the obligation is self-imposed. I'm then obligated as the rich guy to contribute to your health care because I've agreed to do it. I've said that I would. Engelhardt says in the absence of that kind of agreement, imposing this obligation is unfair for the person that has the resources but not the greater health issues. And there are other problems that we should note with regard to a right to health care. And I want to state here, my purpose is not to argue against a right to health care. I think it's possible that there might be such a thing as a right to health care. It's to just carve out what has to be answered and what we need to talk about if we're going to talk about whether there's a right to health care. One thing we need to know is what the content of this right is. So to say that I have a right to health care is not very helpful if I don't know what that means. Does that mean that I have a right to whatever health care I want? Does it mean that I have the right to a right to the best available health care? Does it mean that I have a right only to sort of emergency and preventative care? What is the content of this right? Another question we can ask is, who is obligated by this right? Is this a right that bears on all of us equally? Do some of us have a greater obligation in virtue of our greater resources? And what are we obligated to do? Are we obligated to sort of do things in the community to sort of ensure that our access to healthcare is guaranteed? Or are we just obligated to pay taxes that contribute to a healthcare system? We also might ask what the best system is for ensuring that this right is protected. This is a debate that's going on now in the United States. Whether we should have sort of a government healthcare system like they have in Britain and Canada, which some people have been openly critical of, but they also have these kinds of systems in places like Sweden and Norway, which have the highest standard, and Denmark, which have the highest standard of living in the entire world. So sort of on a matrix. The reason I'm bringing this up is I want to just squash the U.S. system is the best in the world, because what's probably true is that for the richest people, the U.S. system is the best because they can buy the best healthcare money can buy. But for the average citizen, it's absolutely not the best. So there's a sense in which the system we have is the best, and a sense in which it is clearly not. And the question is, what's more important? That everybody sort of has the ability to purchase the best healthcare if they have the money, or that everyone is sort of maintained at a reasonable minimum standard of health. And what the sort of Canadian and British and Norwegian and Swedish and Danish systems have said is what we ought to do is maintain people at a minimum level, as opposed to sort of allowing the economic factors to determine who gets healthcare and who doesn't. But that's still an open question about what the best system is. Again, this is not to say that what we ought to have is government health care. Maybe that what we ought to have is this kind of health insurance supplementation program where people that don't have insurance are sort of assisted or given grants or tax breaks or something that helps to facilitate the purchasing of that. And maybe that we should have sort of a public option. This was part of the debate as well. So there's still a conversation to be had about what the best system is for ensuring that this right is protected. And then there's a question of, which I tried to draw out by sort of berating the American system, best for who? what makes something the best system? Is that it, like, the people at the top are doing the best, so the best results for some individuals, or best sort of distributed across society? What do we mean by best system? There's also a question of whether there's a way to respect this right while still allowing people to purchase better health care if they want to. The concern is that if you have a system, sort of a state-sponsored system, as well as a system that, or the option of purchasing better health care, everybody with the money is just going to buy the better health care, and that's going to drive up the cost of the state-sponsored system. So there's a way in which allowing purchase of better health care undermines the state health care, or the health care that everyone receives. And then we can ask, finally, whether things like self-imposed ailments should be covered. So if you get lung cancer because you smoke all the time, should that be covered by, like, a state health system, or a health system that everyone contributes to? Or is that outside the purview of this right to health care? Have you sort of opted out of care with regard to that ailment because of your own behavior? This comes up a lot when we talk about things like liver transplantation, and whether alcoholics should have access to livers and things like that as well. Okay, the last thing we're going to talk about is this concept of a decent minimum of care, because there's disagreement both in the field and amongst the authors that we looked at about what this consists of. Now the thought is, well, suppose people have a right to health care. What does that right imply? What does that mean we're obligated to provide for them? What is that a right to, in other words? And some people have said, well, it's a right to a decent minimum of care, right? A decent minimum standard of healthiness. Now, as a kind of platitude, as a kind of sort of unquestioned social truth, that seems right. Yeah, well, if people have a right to health care, what that would just be a right to a decent minimum. It doesn't seem right that they have a right to sort of the best care that we could possibly give them, because that would be cost prohibitive, mostly. They don't have a right to whatever care they want, because people want all kinds of dumb stuff. And then they want stuff that isn't properly sort of even a health consideration, like plastic surgery and things like that. So this appeal to a decent minimum is a way of sort of adjudicating between these sort of other ways of understanding what a right to health care might mean for people. And so one thought, because what we need to do now is fill in, okay, so what counts as a decent minimum? And one thought is that if equality of opportunity, which is the third argument we looked at, implies a right to health care, what's required is that we put a system in place that tends to restore people to something like what, for lack of a better word, we're going to call normal functioning. So if you have some sort of health issue that prevents you from being able to pursue the kinds of opportunities that a person that didn't have any kind of significant health problem would be able to pursue, that's all that's required. So we sort of restore you to quote-unquote normal functioning. And that is all that's required. And that seems to follow from this argument about fairness. That's what the decent minimum is going to have to be. Now this standard, notice, is a universal standard, because there is something pretty close to a universal standard of normal functioning. Like if you cannot walk, that is not normal statistically. We're talking about statistical normalcy here. We're not talking about sort of normal and deficient or something like that. We're talking about statistically normal. Most people can walk. That's just a fact. It's not sort of bad if you can't walk. It might be. I don't know. Since I can walk, I'm not sure. But statistically, it's normal for people to be able to walk. It's normal for people to have a certain level of lung functioning or heart functioning, nervous system functioning. So if you don't have these things, and if equality of opportunity is what implies a right to health care, then it seems like what we're obligated to do is restore you to a state where you're on an equal playing field in terms of your capabilities. Now, a nice thing about this standard is that it's universal, as I mentioned, and as I've sort of am now returning to. It might be that on an understanding of this sort, coverage is going to be limited to basic health and catastrophe coverages. So it's not going to involve sort of optional, unnecessary treatment like plastic surgery, which we all, I mean, I don't know if we all do, but I think many of us probably think is not something that should fall under a right to health care. And that's going to be it. So the nice thing here is that a decent minimum understood in this way is going to limit our obligations, right? It's not going to require that we sort of shell out massive amounts of money in order to cover everything that someone might want. And Daniels claims, although I think he's mistaken about this, that this is a compromise formulation, that there are features of this that everyone could sort of get behind. The utilitarian might like that this is sort of distributive, that we're sort of assessing everyone equally. We're taking a tally of sort of what would be good for people. The egalitarian likes that we're emphasizing equality, and the libertarian would like that we're sort of making an effort to minimize the obligation to give up one's property that is inevitably going to be imposed by a positive right to health care. So you might think, and Daniels claims, that this is a compromise view. Now, other people, among them Tristan Engelhardt, who we read for this section, says that a decent minimum healthcare can't be that. It can't be what Daniels thinks it is, because that actually is involves a commitment to an egalitarian view of justice, which is a view that says, look, what makes institutions and societies just is the extent to which it promotes equality of opportunity and sort of equality of benefit and things like that. And folks who disagree with Daniels claim that what constitutes a decent minimum of healthcare is going to have to be determined socially, and it's going to have content that varies wildly. So there might be some societies or groups where their understanding of a decent minimum of healthcare is almost no healthcare. And there are going to be others where what constitutes a decent minimum is going to be a fairly significant amount of healthcare. In our current sort of environment, at least pre sort of the current changes that were enacted, we kind of thought that, or seemed to think that the decent minimum was just emergency coverage, because that was the only thing that was really guaranteed for people. Why might we think this, though? Why might we think that what counts as a decent minimum of healthcare is going to vary from society to society? And Engelhardt says, well, it's because there's widespread disagreement about things like moral obligations, justice, the minimally good life, both within societies and across societies. Just because one society thinks that what makes a good life is that you're able to sort of pursue all of your relevant life goals and projects and have meaningful relationships and do all kinds of stuff. That doesn't mean that that's really what a good life consists of, right? And kind of along the same lines, Engelhardt thinks that this is committed to a certain conception of justice. This is committed to the notion that equality is what should promote our decision-making socially. And Engelhardt says, no, there's no agreement about this, right? There's no fact of the matter about what is sort of the right theory of justice. So in the absence of a shared morality and a shared theory of justice, it's only agreement that allows us to legitimately impose obligations on others. So given that we don't agree about what a decent minimum of healthcare would amount to, we have to sort of have a conversation, right? We have to deliberate and think it through and disagree and argue and give arguments and give evidence, and sort of come to a consensus about what a decent minimum of healthcare is going to be. And we have to do that within our social group. That might be within our nation, within our state, within our county. It might be all of those things, and sort of overlapping systems with varying degrees of healthcare coverage. And there's no way in which we can coherently say to another society, look, your decent minimum is the wrong standard, because what we're disagreeing about is sort of the fundamental moral claims and claims about justice that underlie our conception of a decent minimum. So this is another way. This is, you may remember from the very first module, this is a relativistic understanding, a socially relative understanding of a decent minimum of healthcare. And Engelhardt thinks that's what a decent minimum is going to amount to. I want to make just a couple of comments about this. I think we can press Engelhardt a little bit on whether there really is as much widespread disagreement as Engelhardt claims. There's a theorist by the name of John Rawls. He wrote a highly influential book called Theory of Justice. If you have any interest whatsoever in justice, issues related to distribution of goods within society, you should read this book. Massively influential. And on Rawls's view, there is a set of what he calls primary goods, which are the sorts of things that you have to have no matter what you think a good life is. So the thought here is that even if we disagree about what counts as a good life, we have to have Rawlsian primary goods in order to achieve our own conception. And this is going to be things like access to food, clean water, and ironically, Rawls thinks a certain level of healthcare. So what might be true, I think there's a way in which Engelhardt is correct and a way in which Engelhardt is not correct. So it might be that a decent minimum of healthcare is going to vary sort of within an acceptable range, but there's going to be an amount of healthcare that you just can't reasonably go below. So the decent minimum couldn't be zero healthcare, because then you're not providing this primary good that isn't really about a disagreement over what counts as a good life, because you would need this amount of healthcare on any conception of the good life. So it's neutral with regard to what counts as a good life. So I think, although Engelhardt is making a good point, I think there's a sense in which the widespread moral disagreement that he appeals to can be sort of undercut by looking at this notion of primary goods and thinking about what we would need in order to achieve our conception of a good life, kind of no matter what that conception actually was. And then another just brief point is that neither of these conceptions are neutral with regard to one's theory of justice. Daniels' view, which is the rooted in his argument from the fair equality of opportunity, would be totally unacceptable to a libertarian, which is why Engelhardt rejects it. Engelhardt says, and I think he's correct, look, no one who thinks that sort of property rights and freedom and liberty, hence the name libertarian, nobody is going to be, who has a view like that, is going to concede that they're obligated to restore other people to sort of normal functioning. That's an egalitarian position. So Daniels' view is not this sort of consensus compromise view that he takes it to be. And on Engelhardt's position, this seems to be a view that not only, I think no one but a libertarian would agree with, but I think only a moral relativist would agree with. Because Daniels' view is ultimately just that, look, the decent minimum of health care is going to vary sort of from group to group, and it's only in virtue of us agreeing to provide a minimum of health care, or a decent minimum of health care, and agreeing about what that is, that we obligate ourselves. The only theory of justice that thinks that is the libertarian, that you have to agree in order to be obligated. So there's a sense in which neither of these views are kind of neutral in the way that they take themselves to be. I actually don't think Engelhardt thinks his view is neutral. He just thinks he's right. Daniels claims that his view is neutral, and I think that's false. So the point here is that there's a sense in which the question of how to understand a decent minimum of health care is really a question about what you think justice amounts to. Is justice just a matter of sort of libertarian freedom, or is it a matter of equality, or is it a matter of sort of maximizing utility, cross persons? What is the concept of justice that is correct? And depending on what you think that is, that's going to, in many ways, inform whether you think we have a right to health care and what you think it consists of. All right, bottom line, it seems that the debate about whether there is a right to health care is really a debate about whether there's a positive moral right to health care. I've tried to show you that by just carving out these distinctions and explaining why any other conception really doesn't make sense and doesn't get at what's supposed to be significant about this debate. Secondly, I think the strongest argument in favor of such a right is going to be the appeal to equality of opportunity. That was the argument that struck me as most convincing, although you can certainly disagree with that. And to be fair, it is an egalitarian argument. It assumes that equality is more important than something like liberty. And finally, I think, hopefully if nothing else, you've noticed that even if we think there is a right to health care, there are still numerous issues surrounding the matter of a right to health care, particularly how to conceive of the notion that this is a right to a decent minimum of care. That's one of the stickiest issues. A lot of folks think that that's really the right way of going, is the appeal to a decent minimum, but that in no way sort of clears out the tricky questions about it.